Okay. Okay.
So if you've read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
Consider to Atlas protocol,
Yes.
airway, and
Yes.
make sure patent airway and be breathing, see
Yes.
circulation,
Yes.
disability, and exposure.
Okay. Then,
Then do CT scan.
all right. Okay. What is the criteria for doing CT scan for head injury?
Glasgow coma scale dropped in first 2 hours,
Yes.
and vomiting, and
Yes.
signs of increased cranial pressure like seizure or amnesia.
Okay. Please tell me on arrival, patient had Glasgow coma scale of 15, which after later on decreased to 8. Why? What might have happened?
It was a lucid interval.
Okay, what is
Uh,
lucid interval, please?
it is a neurovascular neurosurgical sign when patient after head trauma become uh, what after head trauma relieve the symptoms, and
Yes.
because there is no accumulation of bleeding, then the accumulation of extradural hemorrhage that increase intracranial pressure that become deteriorated and decrease the conscious of the patient.
What is the normal intracranial pressure?
To 15
Hmm, 250 what?
on milligram per
No, intracranial pressure. It should be in millimeter of mercury.
yeah.
Okay, you don't know. All right. Please tell me what are the ways by which you can measure intracranial pressure?
What measure? Oh, okay.
Yes, measure.
There is two methods, invasive and non-invasive.
Very good.
Non-invasive like tympanic membrane displacement and the transcranial Doppler for children or babies.
Okay.
Invasive like intraventricular catheter and lumbar puncture, CSF pressure.
Okay, please tell me, right, would you or would you not consider doing lumbar puncture for this patient?
No, risk for brain herniation or coining.
Very good. Okay, please tell me what is Cushing triad?
Cushing triad, neurovascular reflex, neurovascular
Mixed
after
vagal.
increasing intracranial pressure,
Yes.
there's hypertension and bradycardia and irregular breathing.
All right. Okay. And this is called, yes. All right. Yeah, bradycardia. Yes. Okay. Please tell me what you understand by Monro-Kelly hypothesis.
The brain is intracranial is a fixed box. Have three compartments: the brain 80% and the CSF 10% and blood 10%. If any compartment increase in his size, there's even happen decompensation by another compartment like decrease. And if no compensation or increasing cranial pressure more than 40, that cause brain herniation and edema.
All right. Good. This same patient, if suffers from increased intracranial pressure, what will be the clinical picture? How would you tell that now, okay, my patient is having increased intracranial pressure?
Okay, headache and
All right.
confusion
Yes.
and papilledema.
Yes. And
Maybe what? Vomiting.
okay. And
Oculomotor palsy.
yes.
What?
And
Abducent palsy too.
yes. And all the Cushing triad will be there.
Caution triad. Okay.
And irregular respiratory pattern as well. Okay.
Okay.
Right. Do you think, why do you think patients should have early, like CT should be done earlier in head trauma?
For criteria for CT or what?
Yes, but is there any reason why do you think there has been a criteria?
Because no, I don't know.
Okay. At what Glasgow coma scale do you think patient should be intubated and why?
8.
So this is, did you mention this when you were telling me the management? That's why I'm
Yes, yeah, intubation, yeah.
okay. Right. Please tell me what might be the causes of dilated pupil other than raised intracranial pressure.
Oculomotor palsy or cerebellum edema?
Yeah. There could be herniation causing.
Herniation of brain and cerebral brain stem.
Yes. All right. Right. If you are going to intubate this patient, what measures would you take to decrease the risk of brain injury?
To decrease intracranial or what?
No, you have to tell me what measures would you take when you are intubating this patient so that you can make sure that patient will have less risk of brain injury.
Anesthesia?
Yes, very good.
Okay.
And
Analgesia?
analgesia and anesthesia and analgesia. Okay.
Okay. Stable of his neck and head?
Yes, you'll position the patient to 30 degrees. Yes.
30 degree.
And you'll make sure your patient does not go into hypothermia.
Okay, and
you will
hyperthermia.
manage the input-output like fluid maintenance. Okay, right. If by any chance, all right, okay, you could tell me what are the benefits of intubating the patient at Glasgow, 8?
Benefit, the high oxygen may decrease the intracranial pressure.
Yes.
And make the good oxygenation for tissue.
Okay. Can you help me and read this image, please?
Okay, there is biconvex hyperdense shape in right side.
Yes,
and midline shift.
Yes, and
compressed ventricles.
Okay. Biconvex shape, hyperdense, midline shift, and there is
Ventricle
compression of the
compression.
ventricles. Very good. Right. All done. Thank you.
Yeah. Thank you.